All right, continuing our conversations on how to get started with research in medicine and getting published, mostly aimed towards medical students and residents. I'm again here with Professor John Bertoni talking about this topic. We will be looking at more specifically a case scenario of how to write up for publication a case report. So in brief, a case report is where you summarize the findings and lessons learned from one particular patient's example to publish it for the good of the general community, for them to also know that a case can be published, a case has happened before. So it may be publishable because it adds completely new finding that has never seen or not commonly seen with a particular condition. It may be publishable because you did a treatment that worked very well, and there were some particular lessons learned from that case. What are some reasons you think a case can be published?
I know case reports are not as easily accepted by the best journals now, but I think that is really for clinical reports, that's the essence. If you understand how to do a case report and you fulfill all the needs of the reader to understand, wow, there's a new approach, or there's something I should think about that's different, or now there's a treatment, or here's how we test it, and here's the results, and that's really important.
So what are some easy cases that can be published? So what do you come across and say, okay, oh, I can write about this up?
From my own experience, I had a patient that was thought to be something she wasn't. She was a teenager.
A misdiagnosis?
A misdiagnosis. They said, this is a case of some sort of spinocerebellar degeneration. Now, when you have a long word like that, you know you're not being very precise. And a degeneration could be something toxic. It could be a vitamin deficiency. And in this case, it was vitamin deficiencies.
How about some recent example? Last 1 year, what kind of cases you have written now?
Well, we have cases recently where patients with Parkinson's disease are coming in with symptoms and signs of Parkinson's disease. But the trick is it can be caused by something else. And if we don't think outside the box and consider the possibilities, especially the treatable ones, we're missing opportunities to really prevent disaster and keep the quality of life as high as possible.
So confounding factors. You had patients
Yes.
who were thought to be getting worse from Parkinson's, but they
Right.
were actually having vitamin deficiencies. And their symptoms were a lot attributable to that etiology,
Yes.
second etiology.
Right. If you look at even the work by Dr. Parkinson himself, he said that these people are very slow. He said that these people may have gait problems and fall. And there are other reasons for falling. Alan Roper from Mass General Hospital did a study on diabetic people that had neuropathy. And he found deficiencies in vitamin B1, vitamin B6, vitamin B12 that weren't even thought of. So yes, we can say that's one of the signs of Parkinson's disease. For instance, dementia, hallucinations. But you know, that also happens with thiamine deficiency. And if people don't choose the right foods, they get into that problem. We have to think of those things.
Good. So unusual thing, missing something that, or something that is being commonly missed. I've had written case reports about patients presenting with Parkinson's, not responding to medication, found to have a positive syphilis test.
Yes.
So syphilis is not a common reported
Right.
cause, although it's always thought of. But in the literature, there were not many cases.
Right.
And I also commonly write case reports on new genetic variants.
Right.
So a chromosomal deletion, microdeletion, or an exact genetic variation, which is not commonly seen. So some of these genetic variations have been described before, and I might still write it up if there have been only 2 or 3 cases written
Right.
up before, so there's not enough information on the patients to understand what is the genotype-phenotype correlation, how
Right.
different ways that patient can present. So those are some of the examples what you can write up in the case report. I agree with you. Case reports are harder to get published these days, but they are still very acceptable in some journals. There are some journals specifically
Sure.
for case reports.
Sure.
And they're also a very common way to submit an abstract to a conference, to a meeting.
Right. And when you present an abstract, and you've done plenty of those, you are met by people intensely interested in this case or this work. And you can learn so much from them. You can establish a connection. You can collect cases, both of you, and then write up a series. And you can make an advance that way that you couldn't otherwise.
Good.
These meetings are
So
very
let's
good.
talk about some of the steps involved in writing up a case report. So what's the first thing a student should do when you're advising her to write up a case report, and the second step?
Sure. Well, if someone comes to you or has an interesting case, they need some advice. You need to find somebody more senior, somebody that knows how the system works. But in a situation where it's about treating patients correctly, and if some student, some aspiring, next Einstein is coming up and you happen to be mentoring that person, here's what I would do. First of all, write down the details of this case and write down the usual, the history, the background, and write the essence of it, what their problems were, what you thought, what you tested, what you found out, what you thought, and then how you came up with your solution. That's the essence of a case report.
So a good, detailed, thorough summary
Yes.
of the whole case, and it would probably be much larger than what you would eventually publish.
Yes.
But you need a good comprehensive summary that you can always go
Right.
back to if there was a confusion later on.
Sure.
Which will get edited much shorter and shorter. In the end, it may be less than a third of the actual published report, depending
Right.
on how long that report is.
Right.
But you have to have a good, thorough, detailed summary. So once a summary has been created, what's the second step about writing a case report?
Well, this has been something that inspires this young up-and-coming person. So now you have to check the literature to see what is already known about this or what approaches have been tried in the past. And you may find one or two other cases, or you may find nobody thought about this. And it's easier to review the literature now. There are search engines, there are people that can advise you on this. There's the international non-English literature. You really should have a wide net if you're going to be doing something that you think is really new.
Very good. I will actually do a separate video on more details on literature search, sharing some of my techniques and approaches on how
Right.
to do literature search. So you have a good summary of what has been published about it, and you have the summary of the case itself. What else do you need to put this all together into a publishable paper?
Well, let me just go back a second. If you can write it down in about a 3-sentence short story, very brief, and then fill it up, and like you say, get expansive, put in all sorts of details, and then you can pare it down later because there's only so much room in journals these days. They don't like to waste space. It's expensive. I think you really will learn as you go. I don't know if there's much more to say. What else? I think you should have a critical view. You can also call up an editor and just run it by them. Here's the case. This is what we're trying to think. What do you think we would need to get accepted in your journal?
I really like your idea that you mentioned, that to have a 3-line summary. If you don't know why you're writing or what you're writing about,
Right.
then it will be hard to show it in your paper. So your paper should actually have a feeling on exactly what is your point, what are you trying to say, what's your heading, what's your
Right.
headline. And then most editorial teams are reachable. You may not, even if you're not able to reach the editor or editor-in-chief himself, there are many associate and assistant editors, and there may even be an office coordinator who you could send an email to and just ask that
Right.
your journal accept case reports, or does your journal accept case reports, and this is the kind of case report I have, would that be reasonable, or any suggestion you have. And a lot of them will actually write back and give you advice. But having a mentor is useful too, and if
Right.
you are working with someone a senior author helping you write it up, then they can suggest an advice on how that should be put together and what journal should be targeted for. You need some references to close the loop. Case reports often don't have an abstract. Sometimes you have to write a 3-line summary to send as a cover letter to the editor so that they can understand, is it important to even read your paper or not. And that's why those 3-line summary has to be really clear on what you're trying to suggest or pitch or publish. And then the case report could be submitted either as a brief communication or letter to the editor, which are usually very small, few hundred words, only a few references, and you have to be within that confinement, but you could probably go to a much higher impact factors journal that way. Or it could be much more expensive. Some journals specifically for case report actually ask you to kind of review the whole topic while writing a case report. Yes. So it could actually be a review of the whole topic. So I could review the whole idea of all published data on syphilis and Parkinson's as a case report. So case report is just a lead in, like a problem-based learning, into the review of the whole topic. And then you can label it as a review, and you have much more space to work with, and then you have to be more comprehensive and thorough with your data search.
One thing that just occurred to me also is that, for example, this one case of a woman who couldn't absorb fat-soluble vitamins. I looked up in the animal literature and found a type of vitamin E deficiency that was used in rats that developed scoliosis and a whole lot of other problems that this individual had. So if you can have another point of view from this is very similar to this animal model, then that makes it a lot more credible. It just could be, the problem you have to overcome is, this is one case, maybe it's just association. Maybe this isn't the cause. You had two things happen at once. But if you find some way to at least get people to think, no, I'm right, this is a deficiency. Gimmicks like that, you have to think about these things and be strategic. But do it. Write it down, ask for help, get started, and before you know it, you've submitted an abstract.
Very good. Moving on to the next topic here. You are working on currently a case series on patients with vitamin deficiencies, nutritional deficiencies, and Parkinson's. So what's a case series? How it's different than case report, and why that made you go for a case series in that particular situation?
For example, an elderly lady that comes in with Parkinson's disease and having hallucinations. We say, well, are we sure it's Parkinson's disease? So I hope I'm answering your question. I look for similar cases. There's a lot of patients with Parkinson's disease that have hallucinations, unfortunately. But if we look to see what they're eating and we analyze their diet and we find that it's a horrible diet, people with Parkinson's disease don't have a good sense of smell. They choose the sweets and the salty foods and not the nourishing foods. We've evolved to be eating the proper substances because they taste good to us. But without a good sense of olfaction, you're missing a chunk. So we're also working with the Harvard people who have developed a food questionnaire. And in the meantime, we're trying to collect other cases that are similar and analyze them for a vitamin deficiency. And as you know, we found several cases. So we then have a stronger case to make that it wasn't just 1 out of a million cases that was this one patient. If we know who to look for, we can find other very treatable causes of hallucinations, neuropathy, you name it, and otherwise the patient would be in a nursing home and would not do very well.
So if I summarize it, if you have a few cases that look very similar and have the same underlying idea that you would have published as a case report, then you can actually convert it into a case series and report a series of cases, maybe 3, maybe 5, 6, or 7. A lot of really smart discoveries actually started as case series where a pattern was being observed. The most interesting case series I can think of is the patients with MPTP. lesions.
yes.
So there was these kids who were coming in with acute young onset Parkinson's within weeks, and there was one, and then there was two, there was three, there was four, and that started like a series of few cases, which led to a hunt of finding this MPTP
Right.
product that was damaging their brain, and other things, you know, that have started as case series as an observation of a new clinical phenomena not fitting into known clinical
Right.
phenomena,
Sure.
and leading to discovery of a new diagnosis and new management paradigm and things like that.
You know, this idea of, I found a case with vitamin E deficiency, and then we found other ones and got that published. We came across people that were getting a contrast medium for milligrams, and they were getting very confused, and they were having babbling speech, and it only lasted a couple of hours. I looked very carefully at the actual chemical formula, and I found out it was an analog of 2-deoxyglucose with a long side chain that had iodine in the side chain to make it a contrast agent. At that time, there were only oil-based contrast agents, and this was the first water-soluble one. And we wrote up many cases of this phenomenon, and I traced it back and then found out what the chemical formula was, and that was another case series. Then I found something in the brains of different animals and found that it does inhibit glucose utilization. I made homogenates of first rat brain and then dog brain and then actually got some human brain. And it was a little different in each one, but we showed that this inhibited glucose, the first step of oxidation of glucose, and the hexokinase step. That was the place it was being affected. So there's another example of what I learned from the vitamin deficiency case. I applied, and we got more examples of it, and we published many articles on that. The other thing is, once you get your foot in the door and you have shown something and have published something, it's much easier to get the second and the third one published.